And I'm back. I still haven't ate anything. Except for what I just now got. I just now starting to move around a little bit. I've been weak all day. Uh-oh. But hey y'all. Welcome to Lovely J Podcast. This ain't the complaint center, but I do not feel the best that I think I ought to be feeling. We're going to talk about healthcare and social disparities. That's how I should have. Yeah, I did name it social worker disparities. Conversation very dear to me because, and I'm cooking some, I'm just going to do a simple bacon, egg, and cheese sandwich. That's it. And I got some yogurt that I'm just nibbling on. It's helping me a little bit. Helping me get my appetite on, because I got to eat something. I feel weak. Overall, I feel weak. Sometimes I talk my way through these weaknesses. That's what we know about me. Is that I will talk my way through whatever I'm going through. But I was thinking all day long. I have like good health insurance. Good benefits on that health insurance. But you know what I realized? The health insurance, even with the benefits, are only as good as the people, as your caseworkers. Let me put it like that. To have good insurance, health insurance, and it actually work in your favor is one thing. But if you have social workers, on the other hand, who are, part of this, let's exclude them from the benefits. We'll charge them what we're supposed to charge them. But let's be as minimum as possible when it comes down to really tending to their health care. I want you to minimize them so bad that they'll want to go somewhere else. And we can, and if we keep up the trend, that yogurt got me swallowing hard. And if we keep up the trend of them being frustrated with how we care for them, then just maybe if they switch to enough doctors, we can make it seem like they are the problem versus we have singled them out for whatever social reason or whatever reason. It could be a retaliation from somebody. Somebody, may have been like, well, let's get that entire family. And that's just a little bit of what goes on in the real world. I wonder if this is still some good. I did not mean to leave my stir fry out, and I did. Let me smell it. So if they can aggravate you enough to get you to continue complaining and skipping from doctor to doctor, I know that ain't no good. Never mind. Let me just throw that away. The bottom of it was open. Such a bummer. But if they can get you to act out every time you're in their presence, and this is something I had to learn as being one of those who were outcasted or blacklisted, or as the doctor said, which I don't think they meant for me to hear it, but and they wasn't even talking about me at the time. They were talking about somebody else. They said, well, she's part of the system, so what we do is just give them something to satisfy them, to hush them up and send them on home. The healthcare plan really does not include the patient. In other words, when these disparities begin to happen, they don't include the patient. They give you the generic version of what it would look like as if they were really treating you as a patient. But in real time, they're not looking at you as a patient, and they're not telling you everything that they put in their notes, which I think is wishy-washy. I think it's double standards. I think it's misleading to the patient to think that they're getting the best care, but really, they're not. Well, I had the honors of going. I had one of the best doctors that I could have ever been to in my lifetime years ago. And I don't know what happened, but somebody said I missed an appointment, and then all of a sudden, I was put out of the first health system. And so I had to go find a new doctor. That's where I'm currently at, the new doctor. So I've only had really like 2 main doctors in my entire life. I don't like to up and go and bounce around, because then your medical history gets messed up along the way as you're moving from person to person. But then I find out that it doesn't matter if you move from person to person or not, or doctor to doctor, because if you're already listed as part of the system, you're automatically going to be flagged and treated as if your life don't matter. That's an automatic. You could be, just starting out with somebody, don't even know them from apples and oranges. But these disparities are getting more. I wanted to say covert, but no, they're not. People are coming more out with who they really are now. The chiefs are no longer hiding, but the main chiefs are hiding. The main wolves are hiding. But the ones that they hire, they feel so entitled that they're not hiding what they really do to people. So let's talk about these healthcare disparities, and they're based on social status. And I'm going to read some of the things that I have found out. I already knew it, but just for the sake of saying it the correct way for y'all, I will read it as I am cleaning this pan out before I start cooking. Healthcare disparities based on social status refer to the unequal distribution of healthcare resources and services and outcomes among individuals or groups of different social economic positions. These disparities can result in poor health outcomes, limited access to health care, and inadequate social support for marginalized populations. Do you know who those populations are? Those populations are poor and low income. And they are also the population that has been blacklisted. Now understand this part. Poor is not the same thing as being blacklisted. A rich man can be blacklisted. A poor man can be blacklisted. But poor, just plain old poor and in poverty is one thing. But to be in poverty and blacklisted is a total different thing. Because you are judged differently, you are treated differently. They will hire, these people who rank this, they will hire the poor to make you feel worse than what you are. They will hire the poor to do their dirty work, okay? So there's a difference between the blacklisting and just, being part of that population that's marginalized. And the outcome is bad because if you spend all the time you get, okay, so I'm going to use me as an example. Most days I'm in pain, excruciating pain, chronic pain, been like this for years. And on days that I finally do get a whiff that, get up or get the strength to get up, like today was a chronic pain day. When I do finally get the strength to get up and do something, the people I go see do not work with me. Instead, they give me a hard time, which means I'm sitting there debating, do I fuss back and lose my energy that it may take just to walk out of here? Or do, I just take what they're doing to me and just take that little piece of information they give me and try to work with it? It's kind of like having a man who's a half a man. You ever been in a relationship and you heard the old song from Betty Wright? She said, having a piece of man is better than having no man at all. And that's what it feels like to me. These healthcare disparities are like, well, if I can just get a little bit of attention for what's going on in my body, that it's better than nothing. And that was how I was seeing things at first before 2022. I was like, I really wasn't as aware of it as I am now. But when 2022 came and I noticed there was a change up in how people were treating me, that's when I was like, oh my God, this is no longer about poverty. This is about social statuses for those who have that type of power. And that's what it's about. It's no longer about poverty. And at what point was it ever about poverty? The way I see it. Because the rich know without the poor that they can't gain the riches. Am I right? Because if you don't have these community programs, a lot of the rich would not even have jobs. They wouldn't be CEOs. They would not be board members. Board members get paid good, by the way. They would not be in the place of, calling the shots if it was not for people that they have to call the shots over. So me and you as consumers and as marginalized populations, without us, there is no growth really. Because the rich people going to come in here and just be for themselves, which means, they already going to have who they need in their corner, and there won't be any government benefits distributed. So do you see kind of how this thing works? It's all about social statuses. If you want good health care, you got to be in the in crowd. You got to be in that social status that says, okay, we approve this person. They might not make much money, but we're going to approve them just because they did some favors for us. This is how it's so easy for people to run these scams using your Medicaid card. And they give you a hard time to get these Medicaid cards. And once you get them, it's hard to keep them. Once that year is up, now it's a lot easier now than it was back in the day. Back in the day, they had us recertifying like every 6 months. But now it's like once a year. And the requirements aren't as hard on us as they used to be. Okay, so types of social status-based healthcare disparities is going to be income, education, occupation, insurance, and factors contributing to social status-based healthcare disparities is going to be limited access to healthcare services. Individuals with lower socioeconomic status may face barriers in accessing healthcare services, including lack of transportation, childcare, or time off work. Now, let me touch on that. Now, when it comes down to people like me who are on the flag list, we got good insurance, okay? Don't get me wrong. Medicaid and Medicare, they do pay for their people. They do. They pay for their people. They pay for all them tests and preventative measures. They get paid just as much for doing preventative measures as they do the merger itself, as they do the sickness itself. To prevent these illnesses, people are paid good money. Doctors receive good money. Pharmacists receive good money. Who else has got their hands in it? The boards, the directors and the boards, everybody receives good money if they could prevent this. But we still need a number of people to be sick and a number of people to experiment on. And those experiments happen to be with the people who are from these low-income communities or, as he say, part of the system. in these healthcare things, you do have to be approved. And once you are approved, then they go in and treat you. I have been to several specialists since 2022. Never went to that many specialists in my entire career being sick. Because that's what it's like. In my entire career, not career, but in my entire time that I have been sick, I have never seen so many specialists in all my life. And just about all the places where I was sent to, they would tell me that the test I took was negative, meaning whatever I was there for, I didn't have it. Now, they have to sign you up for something if you're complaining and constantly complaining. They got to send you somewhere. But the thing is, are the tests really negative? Because at this point, it's hard to believe who's telling the truth. Is the test really negative? Or are you just telling me this so you can prolong whatever it is and I end up more sicker? You see how it works? So if they withhold information from you, and this is where poor healthcare literacy comes in, individuals with lower levels of education or health literacy may struggle to understand their health conditions, treatment options, and healthcare instructions. And if you got a doctor that's part of the system that says it's certain ones we just not going to heal. I don't care what insurance pays. We're not going to heal them. We're not going to touch them. We can see them so that we don't get sued or, get in trouble for discrimination. But if we let them in our offices, we can't treat them. We can prescribe them medicine, but we can't tell them what this medicine is for. We can't tell them how to use this medicine. We can say they're overweight, morbid, obese, but we can't tell them directly what would be a good way for them to lose the weight. But we can prescribe the medicine, but we're not going to tell you how to take the medicine. And then when you go to the pharmacy, who is part of the system too, the pharmacy doesn't tell you how to take the medicine. They just give you your medicine and boom, you're in and out just like that. And because you have poor health care literacy, a person might feel, hey, that was fast. They were good to me. I ain't had no problem with that. But there is a problem. You don't understand what you got. You don't understand the medicine you got. So how do you expect to get healed? And how will you know if you are healed if you don't understand what you're dealing with? See, these are them contributing factors to social status-based healthcare disparities. They're not going to tell you. And if you're not a person who likes to read or do research, you'll be out there taking all kind of pills and thinking that, hey, well, I got to take this, if I don't take this. They teach you how to act out, by the way. They train you how to act out, depending on what kind of medicine they prescribe you. If they prescribe you something for mental health, they'll tell you, listen at the training. It's indirect, but they'll tell you, take this or else you're going to have hallucinations. Take this or else you're going to hear voices in your head. Now, that may be true for some, but that might not be true for all. Somebody might just have anxiety. They may not be schizophrenic. They may just, had a bad break, went through a crisis, and need something to take the edge off, but may not be to the point where they can't cope with what's going on. But if you have poor healthcare literacy, again, you're not going to understand that you don't need everything that sometimes they're trying to give you. And if you do need what they're trying to give you, at what basis? They need to tell you why they are prescribing certain things to you. I had somebody prescribe steroids to me, but it was for my bad knee, but with the paperwork said acute bronchitis. I didn't have acute bronchitis. Okay, but let's keep going. Discrimination and bias. Healthcare providers may hold bias or stereotypes that influence their treatment decisions, leading to disparities in care. I've talked about it so many times. I'm going to keep on talking about it because that's what, I might not can get out here and do as much as I want to do. But one thing about it, if somebody comes across this podcast, they will have a little education in behind them. They will have a little more clear understanding as to what these big terms mean. Stereotypes. Some providers will not treat you adequately, or they'll treat you with disrespect. I had one that always just liked to cuss in front of me. Every word came out was the F word, or, it was just real disrespectful. And she was a Christian therapist. I requested to have a Christian therapist, one that was faith-based. Now, I'm not telling you I don't cuss every once in a while, but when it comes down to doing professional things, I'm not going to sit there and be cussing. Y'all, this is the bacon cutting up over here. I'm not going to sit there and every word you hear out my mouth is going to be a cuss word. Well, this lady here, I knew from the moment she started talking, I did not want to deal with her. But I held on in there with her. Do you know that I was right from the start? That woman left. Didn't tell me that she was leaving. I had to get a phone call saying you could no longer come down here. You go to the internet and find you a new therapist. That's how disrespectful it was. Again, it's because of the stereotypes and these biases that are right before our eyes. When COVID first came out, do I need to cover this up so we can hear me? I'll see. I've never cooked bacon with the lid on it, but I'll try it this time. Just for the second time, y'all. When COVID first came out, what was the first thing they were saying? We want to make sure that we take care of the most vulnerable patients out here, or the most vulnerable people. Who are those people? Those are the people with chronic healthcare illnesses. Those are kids. Those are the elderly. And those are the ones who are in institutions such as the nursing home. Those were the most vulnerable people. Now, among the most vulnerable people population, how many of those are actually not just part of the system, but part of the flag system of where we will treat you, but we're going to give you basic care even if your insurance is paying for top-notch care? Out of all those people, how many got full benefits for what their insurance was paying for? See, because the stereotypes influence their treatments. And this is going to lead to disparities in healthcare. It's going to lead to disparities in getting the proper assessments when it's coming down time for your renewals, for your Medicaid, your Medicare, any government assisted programs that could be in housing. It don't just have to be health. It can be other things. Anywhere the government has a hand in, if you've got somebody working behind those desks that are biased, they just really there for the job. And if they don't feel like you deserve it, based upon their feeling, not what's really, not the guidelines, but based upon their feelings, if they do not feel like you deserve the health care and attention, then they'll reduce your benefits. Or they can make it where it's hard for you to obtain benefits or continue with the benefits that you have. When my parents were first, when my daddy first was diagnosed with the Alzheimer's, before that, they didn't have problems with their health care or paying for premiums. My daddy was paying for his medicine out of his check. That's what he was doing. He was paying cash for everything. He didn't have Medicaid and all that stuff. But when it was time for him to get Medicaid, when his money started getting funny, it was so hard for him. Here was this 70-some-year-old man mentioned a veteran who had it hard trying to get the health care that he needed based upon who they felt should have it. Okay, let's go on to social determinants of health. Individuals with lower socio-economic status may be more likely to experience social determinants of health such as poverty, housing instability, and food insecurity, which can negatively impact their health outcomes. I've been there. 2017. In 2017, well, it started in 2016. When I tried to get my vehicle fixed, I spent $2,000. And mind you, it took me saving up the money to try to get my vehicle fixed. Every month, I was giving this man, well, it wasn't really saving, or, well, it could be considered saving, because when he told me how much it was going to cost to get the vehicle fixed, every month I was paying this man $200, $300, $400. It seemed like every time my car went to him and came back, it was something else wrong with it. And the more I paid this man, the more kept going wrong with my vehicle. I went into a depression because any little money I did have left, I no longer had. Because keep in mind, when these disparities happen, it's not just happening in healthcare, but it happens all over. Oh, this bacon looks so good, y'all. It smells so good. It happens with businesses. When you're talking about government will hurry up and notify businesses of who you are and how they are to treat you. So if you ever make somebody mad that's in government and they have an arm and they can control, whether you get approved or denied for some things, and you don't have that literacy behind you, that's going to be hard on you. But that guy, when you're on a fixed income, you don't have money to play around. You don't have much to play around with now. You might have $100 to play around with. But for the most part, you're barely making ends meet. So when something upsets the process, it don't upset it just for that month or the next month. It may upset your financial process for the next 2 to 3 years. The next year. Don't know. But I know for me, it upsetted my financial needs for it would be the next 5 years, because I could not get a car until 5 years later after he messed up my car. Because the thing about it is, because we don't work like that, we can't say, well, I'm going to go ahead and make extra production and I'm going to, make that money back up. It doesn't work like that. You don't get to make back up monthly income. Once that money is spent, it's gone. And that was hard on me. It impacted my eating needs. And during this time, this is when I started writing the book. I was so hungry that night. I went to bed so hungry. Keep in mind, because I didn't spend all this money on this car, so I don't have food. I'm taking grocery money. Just like now, I'm in a debate between, I'm not going to say but I spent my grocery money trying to fix the car to make sure I was getting back and forth with my doctor. And it got to where I could not see my doctor like I needed to, so I was malnutrition. Even though I was still big people can't get malnutrition. If you do not eat the right foods, you can be malnutrition. I was malnutrition. I was so weak from not eating. Most days, all I could do was stay in the bed because I was so weak. Could not eat. didn't have the food to eat. And then when some people would bring me plates, I don't know about y'all, but I'm a little funny sometimes. I would eat some of it, and then I would see what they had done something to it, and I couldn't eat it. So those would usually just stack up in the refrigerator and be for trash. But more of it all, it affected how I took care of my home. I wasn't able to do any maintenance on my home. And that's why now I'm suffering with the roof leaks that I got going on now. I need a roof right now. Food insecurity was a big thing. Out of that, I wrote a book called Poverty Line Among Us. And one day, I may read that book to y'all. It's on Amazon. I haven't really sold. Just for anybody that's listening, I haven't really sold anything. I haven't made anything off of that. But it's called Poverty Line Among Us. And if you are in the Kindle Direct program, you can read that book for free. And if you're not, it's only 99 cents, I think. But these are the problems that I ran into that affected, because I couldn't eat, it affected my health. Because I didn't have the money to get the maintenance done on my home, it affected my living conditions. We're talking about mold at some places, and I had to really take my time and go through here and do a lot of work on this house. And to this day, do you know, that was in 2017. To this day, I'm still, every month, I try to buy a little something that's going to help fix my home. That's what I try to do every month. But here lately, I haven't been able to really buy like I want to. But that's always my goal, is to try to keep my home fixed. Because I can go to a food bank at times and get food. But you can't go to a food bank and get another home. So addressing disparities in healthcare will help to increase. Oh, what am I doing? Okay, I see what I'm doing. I'm moving a lot of stuff around right about now. When we talk about these healthcare disparities, even though there are mean people in certain places, and it's not everybody isn't like this. I remember there used to be one lady. Her name was Betty. And she worked at the Department of Social Service. And how I remember Betty is, I wasn't old enough then. But how I remember her, I was a child. And, sometimes these disparities run in generations. It goes for generations. But I was a child, and I remember my mom, my biological mom, always saying, well, I can go to Betty and talk to Betty and see what she say about doing certain things. So Betty had a good name. She had a good name for herself. She had a name for helping. I don't know if I want a fried egg or a scrambled egg. I'm trying to make me a sandwich. The bacon is done. But Betty had a name for helping black people. That's how I would say it. She made a name for herself for helping black people. When nobody else would help them, you could go to Betty. And Betty would take a look and see what's going on. And if Betty could do something to help you, she was doing something to help you. And as I got older and I started having my own kids, Betty was still there at the time. But it just reminded me that there are some good people. And she was one that I remembered. So keep in mind, when you do something to the parents, the kids remember. And by the time I had kids, Betty was retiring. She was retiring. The kids you hurt today are the kids who are supposed to take care of you tomorrow. So when you hurting their parents, kids are watching. They're listening. They live in it. They don't have no choice but to live it. And we as kids, we were living that. And when we got older, we still remembered that social worker's name. Even though the social worker never talked to us, not one day. But based upon how nice she was to our family, she was remembered for her kindness. So that's why it's always good to address these healthcare disparities. Increase access to healthcare services. When we address it, it helps to implement policies and programs that increase access to healthcare services such as community health centers, telemedicine, and patient navigation programs. Which is sad to say, but a lot of these programs that are out here now are not for the patients nor the caregivers. We need caregiver programs. Caregivers are burnt out. It wouldn't hurt if caregivers had a little, if they had a support meet that was sponsored by the government. I don't know if that's a thing or not, but you know, if they was supported, they could be better caregivers, you know, because they get burned out. Health centers. Telemedicine. Telemedicine is good, especially for people like me who can't always get out like we want to if we got problems going on with our legs or whatever. How about those people with anxiety or any type of mental illness where they're not comfortable going in public around people? Telemedicine, they'll still get what they need, but in the privacy of their own home. It matters. Community health centers. Community health centers are good, but we got to make sure, again, that we're not being racial biased. A lot of the people now that I see putting up things, they want it either for all whites, or they want it for all blacks, or they want it for all Hispanics. And we just can't get by like that. That's like segregating everybody again. So the people who open up these community centers, they need to make it known that their establishments are for everyone, that everyone is welcome, so that we can all get our health care, not just from one place. The improve health care literacy, develop and implement health education programs that address the unique needs of marginalized populations. We need that. And you know what? I don't think it would hurt doctors to go the same way they have to hold on to their certification. I don't think it would hurt them to have some classes in humanity. You know, they need to be renewed and remember that just because we are the patients does not mean that we don't have feelings or that we don't want to learn how to do better. I saw on CBS on TikTok, it was the news, that they said obesity is going down now. Obesity in the United States is going down now. Why is that? It's not just because of the shot. It's because people are understanding more that what you put in you, it can make or break you. People have more understanding to that now. Friends of friends of friends of friends are telling each other, you know, whatever they learned, they're sharing it. It's not just because of the weight loss shots. It's because they're out here sharing that information that they're learning. Somewhere they are getting good information, and that information is spreading online. Don't you see programs like TikTok? They are spreading these informations of how to lose weight, and, you know, what are some alternatives you can take besides taking a lot of pills that's going to shut your organs down. They are spreading good health behavior through social media. You remember that, you remember when the McBains first came out, the food McBains? Everybody was doing all this food eating, and at first it was getting its praises. At first, but that didn't last long. There's still channels up that do it. I don't really watch them like that anymore, but I remember when it was so fascinating. When I first started watching it, and me and my granddaughters, we would try to, you know, get us some Ooga noodles because it's cheapest food, and we try to eat like they were eating, even though we had a regular sized meal. But we wanted to see what it felt like. Y'all know. Y'all probably tried it too. And then we realized that you eat like that, you feel horrible. So we get to watch people now who don't glorify the gluttony. But we get to watch any type of people now. People who have survived food binges. You know, we get to watch the health. We get health care through TikTok for free. And now if it's right or wrong, we'll never know. Because it's more than what we're getting from our doctors. And there are tons of doctors on these social media sites that are giving out good tips. And we're listening to them. And we're not telling our doctors that we're listening to them. Because our doctors should have been the first in line to tell us. Okay? So we're getting our education out there. And that's why we're seeing these numbers get better and improve. We do need to continue addressing discrimination and bias, provide training and education to healthcare providers on cultural competence, diversity, and inclusion to reduce bias and stereotypes. I'm going to be honest, with some of these people, you're just not going to get anywhere with them because they're so self-conceited. Some of them are. They feel like the world will stop when they stop. That's not true. The world doesn't go round just because they say go round today. But, hey, if that's how they feel, I let them go on and have it. Ain't finna stress me out about it. Address social determinants of health. Implement policies and programs that address social determinants of health, such as affordable housing, food-assisted programs, and job training initiatives. I didn't know that Medicare had the program where you can work. I didn't know that. That was something good to learn. Because I didn't know, of course, though, because I haven't been out there in the work field like that. What? Well. Hold up, y'all. I haven't been out there like that, so I wouldn't know, but it was good to hear that. We need that. We need that encouragement. You know, what if it would happen that if we got more encouragement versus, getting put down for what we try to do? That would be nice. That would be nice. Well, just a little thought for today. That was just things that was on my mind. Check it out for yourself. Pay attention to how your doctor treats you or your social workers. I would say get to know your social workers by their names and things, because I'm going to be honest. I don't really deal with, them like that because I've never had anything against my social workers. I've never really known them like that. But I'm telling you from experience now, since I went through some things this past week, get to know who's handling your cases. Because that can make or break your benefits and what you're receiving. Some people will not tell you that, hey, you can do this right here, or we have this type of benefit to fit your situation. Some people will give you bare minimum. And this is where these disparities come in there. Perhaps you did have a job on the side, but you didn't know that they had, these programs there that help you. Which I never called what I was doing a job on the side, because I ain't make, $1, come on. Even if you added up all three of the social media sites that I am monetized on, it doesn't come up to hardly nothing. So don't think because people are monetized that they are making all this big income, because I'm not. I wish I was. If I ever did get to the point where I could come off the assistance that I'm on, if I did get to that point, man, that would be a huge thing for me. But I'm not. This time, just not me. Might be the people I watch. And maybe I'm watching them so I can learn how to be self-efficient in that area. But it's not me. No, this bacon so good. I know what I'm going to do. These eggs finna be scrambled, because that bacon too good. And I'm going to slice me up some tomatoes to go on the side of it. Oh, this is good. So when you get to know your social workers' names, that's going to help you out a lot. I think here in North Carolina it changes every so many months. I don't know what they do, if they rotate the workers or what. I really don't know, because like I said, I really never had a problem with any of my workers. Because usually my paperwork is up to date, and anything they ask me for, I just go ahead and do it. I just comply and I don't question. But this time I had a reason to question, because it was, I felt kind of harassed about, you asking me the same thing that I tell you the same thing every year about, the situation I was going through. It hasn't changed. So that kind of hurts there. All right, y'all. Well, I'm done talking. I gotta get these eggs rolling. I don't know what's going on with my cooker. It's just not been cooking right for me. We've been sitting here 45 minutes. Y'all know doggone well it don't take 45 minutes to cook no eggs and bacon. Again, with these disparities, people like me, our homes get broken into. We are ignored by the police, because the police says, well, if your home gets broken into, just go buy another door. Well, that's easier said than done, because I don't have the funds to do it. I just can't up and get a door. So, even in that area, security, we don't have that. People like us. I'm talking about people like me. Instead of him saying, well, let me take a report of somebody breaking in your house, I got treated as if it was my fault that my house got broken into. And still is. Currently still is. When they take stuff, they put it back, but they don't put it back in the same place. But they do major damage to me mentally like that. And I can't even go to the cops because of the discrimination and the disparities. And if you do go to the cops, like if you go to the cops more than one time, it's a possibility you're going to be treated like you have a mental illness such as schizophrenia or delusional. I was told, oh, you're a single lady? You living by yourself? What's wrong with a 40-some-year-old living by herself? Can y'all tell me that? What's wrong? At what point did society make it seem like being in your 40s and living alone was unsafe? It's safe whenever you don't have people that's doing things to you. For the most part, I'm self-efficient. I can do what I need to get done. I wash myself. I bathe myself. I encourage myself. I drive myself places where I need to go. I'm just one that don't care about going in and out so many times. But they try to make me feel like it's a problem if you are single. I keep getting asked that. Oh, so you live by yourself? Is there somebody there that can help you? I'm not. Listen, I'm disabled. I'm not blind. I'm not deaf. And I do have a phone with me. And I do know how to use a weapon. If I gotta use a weapon on somebody, trust me, I'm not the one that's scared to do it. I will do it. If given that opportunity and that space and it comes down to it, and I can't help myself, not help myself, but yeah, I can't help myself, but I'm trying to defend myself, I'll do what I gotta do. It ain't like I don't know what this stuff is. They were trying to treat me like I was some kind of great-great-grandma. Well, maybe you need to go stay with somebody. What? Are you sick out your mind? I still want a man. And I'm not going to be taking my man to somebody else's house and I got a home. Please, come on. Come on now. But anyway, that's part of the system, and that's how they play you out. That's how they get you out of your place. That's how they get to playing with your mind and make you think that you cannot survive on your own. And you can. You can. Most women can. Most of us can't survive on our own. There was 80-some-year-olds running that 5K race. I was like, goodness gracious. So 40-something is not the age to be worried about somebody living by themselves unless they do have a mental health condition that is so severe, like schizophrenia and things, that they have to have somebody living with them. But when they get tired of you making reports, that's what they'll do. They'll call you that. So that when people come out, they won't take you serious. Yo, why ain't this working? I'm ready to eat my bacon. I can't do it. Okay, y'all. Peace, love, and happiness. Till next time. I gotta go see if my girls won their games today.